Okay, so prostate cancer is a cancer that occurs in the prostate, which is a small walnut-shaped gland in men that produces the seminal fluid that nourishes and transports sperm. It's one of the most common types of cancer in men, and it can cause no signs and symptoms in the early stages, but when it's more advanced, it can cause signs and symptoms like trouble urinating, blood in the semen, discomfort in the pelvic area, bone pain, and erectile dysfunction. For diagnosing prostate cancer, men are recommended to get prostate cancer screenings in their 50s or sooner if they have risk factors for prostate cancer. And the screening test can include a digital rectal exam, which is where a doctor inserts a gloved finger into the rectum to examine the patient's prostate. And if they find any abnormalities in the texture, shape, or size, then further tests are needed. Or there's a prostate-specific antigen or PSA test, which is when a blood sample is drawn from a vein in the patient's arm and then analyzed for PSA, which is a substance that's naturally produced by the prostate gland. And if there's like high amounts of that, then that can indicate that there's prostate infection, inflammation, enlargement, or cancer. And then if either one of those tests detect an abnormality, then the doctor may recommend further tests, such as an ultrasound, or collecting a sample of the prostate tissue, which is called a prostate biopsy. And that's often done with a thin needle that's inserted into the prostate to collect tissue. And then the sample is analyzed in a lab to determine whether cancer cells are present. And then once prostate cancer diagnosis has been made, the doctor works to determine the stage of the cancer. And if they think that it's spread beyond the patient's prostate, they can use an MRI, a CT, or a PET scan. There are some things that put a man at risk for developing prostate cancer, and those are age. Your risk increases as you age. Race. Black men carry a greater risk of prostate cancer than men of any other races. And in Black men, prostate cancer is much more aggressive and more likely to advance. If a man in your family has had prostate cancer, your risk is increased. So if you have a family history of BRCA1 or BRCA2, which is an indicator for breast cancer, it makes your prostate cancer risks higher. And then men who have obesity that are diagnosed with prostate cancer are more likely to have an advanced disease that's difficult to treat. And then the treatment can include surgery, which is called a radical prostatectomy, where they remove the prostate gland, or radiation therapy. And that can either be external beam, which is where beams of radiation are focused on the prostate gland from a machine outside the body, or brachytherapy, which is where small radioactive pellets are placed directly into the prostate. There's also hormone therapy, which is used to stop the body from producing male hormone testosterone. And that can happen from medications that stop the body from producing testosterone, or medications that block testosterone from reaching the cancer cells, or surgery to remove the testicles, which is called a orchiectomy, and that reduces the levels of testosterone in the body. There's also a cryoablation, which is freezing the tissue to kill the cancer cells, and then chemotherapy and immunotherapy, which uses your body's immune system to fight cancer cells. And in this treatment, it takes some of your own immune cells, genetically engineers them, and then injects them back into your body through a vein.
Assessment for someone with prostate cancer. If they have any of these signs and symptoms, they may want to go make an appointment with their doctor. So they could have trouble urinating. They could have blood in their semen, discomfort in the pelvic area, erectile dysfunction, or they could have a decreased force in the stream of urine. So their urination won't be as forceful. It'll be very weak. And then an assessment for what the nurse will do if the patient has any of these symptoms is she'll obtain a health history, get those modifiable and non-modifiable risk factors, and then she'll probably ask the patient about family history and genetics. So if the patient has a history of like the patient's dad or any male in the family that has prostate cancer, and they'll also put age into consideration, and that could help determine if the patient has prostate cancer, and then the doctor will end up coming in and doing his assessments. So for the nursing assessment,
Okay, so possible nursing interventions for prostate cancer. So possible nursing diagnoses can be acute pain, chronic sorrow, deficient knowledge, impaired skin integrity, risk for situational low self-esteem, risk for urinary tract injury, sexual dysfunction, and urinary retention. So some interventions that we can do for some of these diagnoses. For the pain, we can assess their pain, administering pain meds, and teach them non-pharmacological ways to relieve their pain. Patient education is a big thing here as well, especially if it's a first-time diagnosis. So giving them patient education over the disease process, side effects, and treatment plan, just giving them as much knowledge as they can that will kind of relieve some of their anxiety. Emotional support is also a very big thing here, especially because they can have that chronic sorrow, and the situational low self-esteem and sexual dysfunction. So we can provide information over different support groups that they can go to, and different coping strategies that they can use for these things. For sexual dysfunction, we could refer them to any kind of sexual counseling, or maybe help them find some coping enhancements. For their impaired skin integrity, skin surveillance, so checking for wounds, and if they have wounds, provide efficient wound care and implementing infection protection with that. For urinary retention, so they might want to look into urinary bladder training, and if no other interventions will work, we might have to give them a catheter, so an indwelling catheter, or just giving them a straight cath for that.
Okay, so testicular cancer is cancer in the male organs that makes male hormones and sperm, so your testicles. The diagnostic test that you can use to find out if you do have testicular cancer is ultrasounds, blood tests, a biopsy, and imaging tests like ultrasounds, or not like ultrasounds, my bad. What I was trying to say is ultrasounds is the first test that you're gonna do if it's suspected that you have testicular cancer, because it's just like more identifiable, and that's just what they're gonna, it's like the gold standard. If the lump is solid, it's likely to be cancer. And the second thing they're gonna do is blood test. There's tumor markers. AFP and HCG is what will be released. And these will show if you'll have a tumor in your testicles. And these two tests are basically the gold standard for this. You can do a biopsy, but it's not really what they go for. And yeah, because they just go hand in hand with each other. And before doing a biopsy, they rather you do surgery to remove the tumor instead, rather than just going in and cutting a small piece. So people who are at risk for this are individuals who have a family history of testicular cancer, HIV infection, undescended testicle, Caucasian males, age ranging from 20 to 34, and tall men. So I did put 20 to 34 on here, but it can be any age. It can be an infant, it can be an elderly man, it can be any age, but typically it ranges to 20 to 34. And I also, fun fact,
the risk of testicular cancer among white men is 4 to 5 times more than that of African Americans and Asian American men. And I thought it was interesting that they included tall men on here, and they didn't really specify how tall. It just said tall men. And how it's treated is typically surgery. They're gonna go in and remove the testicle. You can do radiation, but typically they'll use radiation for, like, if it has spread to the lymph nodes, they're gonna use it for that type of treatment. And you can use chemo and stem cell transplant. And typically when they use stem cell transplant, it's for someone who had testicular cancer and it came back. So, yeah.
For a patient that is suspected of having testicular cancer, some signs and symptoms include back pain. They may have a lump or an enlargement of either testicle. It doesn't just have to be it doesn't have to be both of them. It can be either one. They may feel like their scrotum is heavy. They may have some aches and pains in their abdomen or groin area. They'll have fluid in their scrotum, possibly, which could probably make it feel like the scrotum is heavy. And then they'll have pain in the testicles or scrotum, tenderness or enlargement of their breast, so their chest area. And then if the patient, like I said, with prostate cancer, if they experience any of these symptoms, then it's a good idea for them to go get checked out by their doctor. As far as a nursing assessment, they will do basically the same thing as a prostate cancer suspicion assessment. So they'll get the health history, look at the age, look at family history, and then those non-modifiable and modifiable risk factors. And then they may also see if there's swelling or a firm lump that may be present. And then further testing will be needed to make a correct diagnosis of this. For a patient that
Okay, so some nursing interventions for testicular cancer. Some possible nursing diagnosis. They're going to be some of the same as prostate cancer, but there are some different ones. So we have acute pain, death anxiety, disturbed body image, fear, hopelessness, sexual dysfunction, and risk for situational low self-esteem. So pain, again, we're going to be assessing their pain, administering pain meds, teaching non-pharmacological ways to relieve their pain. And patient education is a big thing here as well to kind of help them relieve some of that anxiety as much as we can. So patient education over the disease, its process, side effects of the treatment, as well as the disease, and their treatment plan and what their options are. And probably one of the biggest things here is emotional support as well. So they've got the death anxiety, disturbed body image, fear, hopelessness, sexual dysfunction, and risk for situational low self-esteem. So we can provide them information over support groups that they can join and coping strategies, helping and making sure that they have the right coping strategies and there's no harmful strategies in there. We can refer them to sexual counseling, coping enhancement for that, for their death anxiety, getting their family involved, and possibly finding spiritual support for them, as well as just being an active listener. Being an active listener and being there for the patient and being a patient advocate can really help the patient relieve some of their anxiety and let them know that you're there for them and you're giving them the best care possible in their situation. And for their disturbed body image and self-esteem, encouraging body image enhancement, self-esteem enhancement, and providing information for support groups as well. For their fear and hopelessness, coping enhancement, support groups for that, reducing any anxiety that we can control, maybe talking them into looking into counseling. And again, just being an active listener and being a patient advocate for that person can go a long ways.
One of the major concerns with patients who have prostate and testicular cancer are how it's going to affect their reproductive and fertility health. Prostate cancer itself can affect fertility in many ways. The first one is that it can press against reproductive organs and interrupt their normal functions. They can cause hormone imbalances that can affect your fertility. And testicular cancer interferes with and reduces sperm production. It's in research, it shows that the cancer treatment is does more damage to reproductive health than the actual cancer itself. The first way that it can cause decreased fertility is surgical removal of the testicles. The only time it'll cause complete infertility is if both testicles are removed, but it's commonly just in one testicle, so they can still have partial fertility and still be able to reproduce that way. The next is removal of the prostate gland. That will completely cause someone to become infertile because the prostate gland and the testicles work together to produce sperm, and when you take away the prostate gland, it just completely takes away the person's ability to create sperm. The radiation treatment can cause sperm death, and it'll just affect the way that the sperm grows. So even if there is sperm production, it might not be viable sperm to reproduce. Chemotherapy pretty much does the same thing. It's shown that if patients receive chemotherapy before they reach puberty, that it can affect their ability to reproduce long term. So they try to avoid that in younger patients. The longer and higher the level of the treatments, the longer the effects will be of the infertility, and it can be lifelong. And that's it.